The Peter Schiff Show.
Joining me now is my guest, Jack Belinsky, who is president of products of Nature Inc., and they are a distributor of over-the-counter, all-natural products. They were founded in 1994, and they're based here in Ridgefield, Connecticut. Its best-selling product is a natural progesterone cream and can be found nationally in retailers such as GNC. Progesterone is a hormone that is found naturally in the human body, and apparently Nature Inc. is having a huge battle with the FDA over this particular product, and I'd like to introduce my guest now to describe exactly what has been going on with Nature Inc. and the FDA. Jack, welcome to the show.
Yes, Peter, thanks very much.
So first,
describe
to me your product and what it does, why people are buying it.
Well, the product originated almost 70 years ago. It's been sold over the counter in health food stores, and it really blossomed 15 years ago with the emergence of 5 books written by Dr. John Lee. Now, Dr. John Lee, in his practice, previous to writing the books, found that women were not benefiting from synthetic hormones. So he started researching progesterone, and he did 10 years of research and began implementing natural progesterone, which again had been on the market at that time for 40 years, and found amazing benefits for his patients. Now, the importance of maintaining a good progesterone level for women is illustrated in numerous clinical studies, including one by Johns Hopkins in Baltimore, Maryland, where they found that women deficient in progesterone, this was a study of 35 years, die 10 times more often from all cancers. So Dr. Lee did all the research, quit his practice early, retired from his practice, and began touring the country, as well as writing 5 books about progesterone. Now, subsequently, what's happened with the FDA is there are probably 24 firms similar to mine throughout the country that are offering this. It's in every health food store, natural alternative practice.
No, your product, is it this is a cream that's applied topically?
It's applied topically. The hormone goes right through the skin into the bloodstream, so it's a slow release program.
So you can rub it in anywhere on the body?
Absolutely.
And over the course of time, and you said this has been around for a long time, are there any negative side effects? Is anybody being hurt by applying this cream?
There have been no side effects reported. And interestingly, what happened 40 years ago with the advent of what's referred to as HRT, the pharmaceutical industry took this natural progesterone molecule that is bioidentical to what's in a woman's body and converted it chemically so that they could patent it.
Right.
So when they patented it, it became foreign to the body and comes with multitude of side effects and actually causes cancer, strokes, and heart attacks.
But this has now been patented and approved by the FDA.
Correct.
So you can get a prescription for this from a doctor.
Yes. Right now, what's happened in the last 5 years is all the pharmaceutical companies now have seen the benefits of natural progesterone. So the FDA has patented 5 separate drugs, which they previously, all the pharmaceutical companies just wanted the synthetic versions.
Now, are the synthetic versions any more effective than the natural version?
No, actually, most women, 85% of women that take the synthetic version either stop or quit it within a year.
Because of the side effects?
The side effects, right?
What are the side effects?
Oh, the side effects are irritability, depression, as I said, cancer, strokes, and heart attacks.
How much does your cream cost?
The price is $29.95.
And how long is it going to last you?
That's a 3-month supply.
So it's about $10 a month. How much is the synthetic version that is patented and approved by the FDA?
That ranges anywhere up to $250, $300 a month in a pill form. And now they have a new injectable shot that's been FDA approved. If a woman who's pregnant and wants to avoid miscarriage, she can use that, and it's $30,000 for a 9-month supply, which are 20 shots.
Well, that's off the charts. But even if you take the pills, $300 a month versus $10 a month, that means, if you annualize it out, you're talking about, almost $4,000 a year, which probably not that many women can have an extra $4,000 burning a hole in their pocket. But it seems like your cream is pretty affordable. So what's the problem? What is the FDA's problem with your cream?
Well, the problem is we are not allowed under FDA guidelines to say that we can treat menopause, premenopause conditions. We certainly can't talk about the cancer benefits, even though they're illustrated in clinical studies. So the FDA is going after all the companies who sell the product because they're being pressured. And this is actually my FDA attorneys have told me they've spoken with the FDA, and the FDA is being pressured by the drug industry to stop us from selling it because we didn't have to pay millions of dollars for clinical studies and FDA approval.
And they did.
So it's very political. And the FDA's goal is to eliminate as many, if not all, natural products that are in the marketplace.
Right. And the problem is you've got a natural product with no side effects. They've got a synthetic product with all sorts of negative side effects, which means that when you buy that product, you probably have to buy other products to counteract those side effects.
Right.
And so all the FDA here is trying to do is drive up the cost of medicine and drive the quality down. I mean, how can this be in the public interest?
Well, it's certainly not, because also the natural progesterone, it's in a pill form or a suppository. It's been used for 30 years in every fertility clinic in the world. In every OBGYN office, they use the natural because when a mother is pregnant, she certainly can't take drugs.
Well, and so the FDA's problem is you're allowed to sell the product. You just can't market the benefits of the product. You can't say use this product because it will deliver these benefits.
Absolutely correct. And they're taking it a step further, telling us on our label, in naming the product, we have to remove the name progesterone.
Even though that's what it is?
Yes.
And
because it's signifying a benefit to the consumer when actually, since it's over the counter and we don't have a drug license, how could there possibly be a benefit?
But why would you need a drug license if it's not a drug? If it's a naturally occurring...
That's what my lawyer is arguing. Very good.
But
exactly that question.
But now the companies that have the FDA-approved synthetics, they're able to use the word progesterone, even though it doesn't have any progesterone.
Well, they have to use the word progestin, T-I-N, because it is not bioidentical to real progesterone.
Which is what you're selling, but the FDA...
We're selling the bioidentical form, which is what is deficient in a woman, and it's been clinically proven to be absorbed.
I mean, the crazy thing is, why would you even... The crazy thing is, why would you even need this synthetic version if you got the real stuff? Well, what's the point?
Because 40 years ago, they would only patent the synthetic version. Now the drug companies have manipulated the FDA to patent the natural version. So what's going on is that they also argued 40 years ago that we have to change the molecule to make it stronger. Well, when you make it stronger and it's foreign to the body, that's where all the side effects come from. And in 2002, the National Institute of Health stopped a study on 16,000 women using these synthetic progestins because they were causing and showed an increased risk of cancer, strokes, and heart attacks. But they didn't have the guts to take them off the market.
Yeah, does the medical community...
Which is what they should be doing.
Does the medical community have an opinion on progesterone or your creams? Or are there doctors that are...
They do, but they are so clouded and confused by the pharmaceutical rep who buys lunch and comes in and says, this is the latest drug. Here is the contrived clinical study that we did to prove it. Now, here are all the benefits, but it's still acceptable if some women die from using it because they might get a little benefit here and there. Now, that study in 2002, once it hit the news that the National Institute of Health stopped the study because of all these women dying, the amount of prescriptions dropped by 75%.
But nobody has ever died. No one's died from your cream.
Never.
And it's got the same benefits.
That's correct.
For a fraction.
It's
for a
got
fraction
more
of
benefits. It actually works better.
For a fraction of the cost.
Of the cost.
And this only in a country like America where the government is going to get in between. Here you are, a businessman. You want to sell a product that helps people. People want to buy the product, and the government is saying you can't let people know of the benefits of the product. You can't let them know that there's an alternative to this overpriced synthetic drug that's killing people. And all of this supposedly to benefit the public health.
The need for this product is tremendous.
Yeah, I mean, why wouldn't
Women are dying because of the shortage.
Yeah, I mean, what is the
the
rationale? Why, for the FDA to say, look, you can go and claim that this thing that the progesterone reduces the risk of cancer, has all these benefits, and then in a box write that none of this is approved by the FDA, and so it might not be true. And why can't you just disclaim that there's no FDA approval? So take it at your own risk.
Because if you make a medical claim, the FDA has an airtight argument in their opinion. If you make any claim about a natural product, they come back at you and say, where is your drug license? You can only say that a product is beneficial if it's a drug.
Unfortunately, we have an FDA that cares more about the profits of the drug companies than the health of the American consumer or their pocketbooks. But anyway, thanks for being my guest.